We're at a very interesting stage with CML because we've almost won the battle to procure normal survival for patients now. I'm not sure we expected that 5 or 10 years ago, but it seems to be the case with all of the tyrosine kinase inhibitors. Survival is pretty much normal. We still are losing some patients with CML, so we've still got a job to do, but compared to the 90s, it's transformed. What we've seen in the last 5 years, however, is the slow emergence of some somewhat unexpected toxicities, particularly cardiovascular toxicity. So some patients on these drugs are getting strokes or heart attacks or blockages in their arteries in their legs, etc. So I think we're at a point now, a tipping point of very much considering the benefits of treatment in terms of molecular response and what have you, weighing that very carefully against the risks of those treatments and the quality of life associated with those risks, which is a fairly unique position in oncology. Usually you give the treatment and you stop and then take the consequences. Now, because we're in chronic therapy with CML, the balance of those two things is a bit different. The sort of era of genomics and easier and cheaper access to whole genome sequencing, digital PCR, these fantastic new technologies that are coming through, we're only just starting to embrace really. So ask me in 5 or 10 years' time and we might understand the genomic basis of resistance or relapse or what have you, but we're only just starting down that path at the moment. But I expect we'll understand that much better.